All right, congratulations. You are 3 weeks from your Mommy Makeover procedure. And so this is the big one. And at this point, you should feel a whole lot better than you did your first week when I saw you last. This is one of those visits, just basically just continuation and observation and making sure things are healing appropriately. It's pretty straightforward. I have a very well-developed protocol. You met Claudia already. She's my right hand. She's not your best friend, she should be your best friend. But she's been doing this with me for almost 7 years. She's really good at it. And she can answer pretty much any question you can ever think of, and she's pretty much seen any issue that you can ever think of. So you're gonna have this visit with her. I want to go over some of the highlights of this visit and the protocol that I've developed for your procedure after the Mommy Makeover. So the big thing is the garments. Do I have to wear this damn binder anymore? And the answer is no. So today is the day we can get that binder off. You most likely will be downsized in a smaller garment. Again, you're shrinking, and so we continue that shrinking process and getting that shape that we want. But the binder at this point, you're done with it today, so you can burn it if you like. The next part is at the incisions. All these tapes you have on your incisions, we're gonna take those off today, and then we're gonna make sure your wounds are healing up, your incisions are healing up okay. It's very, very common to have like a little bit of raw spot. If you had a breast lift right at the vertical and horizontal incisions, very, very common. We just do local wound care. It's very simple. Those heal very, very quickly. Tummy tuck incisions. Sometimes even a couple little raw spots. And again, a little bit of local wound care. Claudia's gonna go over in detail how to take care of those things, okay? Most of your bruising, it should be gone at this point. The swelling is not 100% gone yet. You will notice that the more persistent swelling is gonna be in your lower back and your lower tummy. That's very normal. Kind of along the side of your chest, also normal. On the side of your breast, very, very common. It's expected, okay? All this can continue to get better. We're gonna accelerate that today and introduce the massage therapy we probably have already talked about. And that's gonna accelerate the swelling recovery. It's gonna help your skin shrink faster. It's gonna help your skin wake up faster. It's gonna make sure all the contours come out smooth like I actually did them. And so it actually feels better. I prefer you do it with us in our spa because we use energy with our massage therapy, and it accelerates the process. And so one session with us is equivalent to doing it 2 or 3 times by hand. And if you can't get to us, then you can do it closer to home with the massage therapist. But you should expect to do it about twice a week for the areas of contouring with a liposuction. And you need to do that for about 8 weeks. So it's a time investment that's very, very well, that pays off very, very well. So I want you to do it. Please do it. It will accelerate your recovery, and it will get you your outcomes that you paid for faster. After that, we're going to talk about some sleeping. So at this point, sleeping on your sides, I'm probably okay with. It's better to be in a fetal position than kind of half side kind of situation. Sleeping on your tummy is definitely not recommended. So either your back or your side. But if you've been in a recliner, hopefully you can get back in the bed and be a little more comfortable. Activity-wise, if you're not back at work in a light-duty job, and you have more of a physical job, like my nurses, my real estate agents are super busy getting in and out of cars, my hairdressers or bartenders who are on your feet all day, 3 weeks is about the time you do that for those occupations. But otherwise, if you're in the office, you should be in the office. You're probably tired in the afternoons, which is expected. But again, every day is going to get better. I've told you that before, and I'll tell you that again. As you get further from surgery, you feel better and better every day. You'll have a little bit more energy. To help speed that feeling better faster, I need you to continue to drink your water. Keep up your protein, please. This is not a time to get back on your GLP-1 weight loss medications. You need calories to heal, so please avoid doing those at this point. It will continue to get better as far as your contour and your activities. I don't want you overdoing exercising. We're going to reintroduce some exercising today. Miss Claudia's going to go over the details of that. But I do want to keep your heart rate under 120. The cardio stuff that you can do are typically going to be the elliptical and the treadmill is what's comfortable. I don't want you overheating. So incisions and sweat do not mix. So we're going to go over that in a little more detail. We'll go with some weight limit restrictions. 25 pounds is really want to limit you to. And also just overusing your core, anything with your chest, I do not want you doing. So Miss Claudia's going to go over those in more detail. The incision will continue to get better every day. And then we're going to start your scar therapy at your next visit, which will be 2 months. So again, please don't ever hesitate to reach out to me or Claudia. Stay in touch with Claudia if any issues arise. And if I need to look at you sooner, I'm always available to you. I'm happy to do so. But otherwise, you will continue to feel better every day. And I'm going to see you next time at your 2-month visit. and I will see you then.